What is the all-on-4? Have you heard that term before in the dental world? Well, today we're going to talk about the all-on-4 dentistry, and make sure you like, subscribe, and share this episode. And welcome to the Wonder Tooth Podcast, Dr. Kamel. Dr. Kamel is one of the top prosthodontists on the East Coast, guys. So he's a pretty big deal. And he used to teach at Rutgers, and he is now working in private practice, changing lives, changing smiles, and helping a lot of people. Welcome to the Wonder Tooth Podcast.
Thank you for having me, Radwa. Thank you. Hi, everyone. Very excited for the topic here, the all-on-4. So before I go to the all-on-4, I wanted just to remind you about what is dental implants. So dental implants we have been used in the dentistry long time ago, and it was changing all the time from a framework till the shape that we have it now, like a tooth root form shape. So dental implants, they help replacing missing teeth. So if we have a one tooth missing here, we can replace, instead of having a bridge, we can just place a root shape or root form titanium implant in the bone, and then we can restore the crown or the tooth, the missing tooth, based on that. So it's three parts: is the implant in the bone, and a connector, and the crown. So what happened, and I'm talking about now the single tooth. What happened if the whole arch, like your patient lost a full arch, like say he has a lower teeth and full upper teeth missing, or they have to go. So we can replace them with the dental implants. How many missing teeth from molar to molar? Say from first molar to missing molar, 12 teeth. Do we place 12 implants? No. So we used to place one every other one, like 6 implants, replacing 12 teeth. So we place the 6 implants from here to here, from one side to one side, from molar to molar, and we connect them with a bridge, or we make them separate. It depends on the design. So what is all-on-4? All-on-4 means instead of using 6 implants, we use only 4. So a guy, Portuguese guy called Paulo Mal, so in late 80s and 90s developed this concept. He's a dental surgeon. He always fight because when we extract the teeth, bone loss happen. So if you don't come as soon as the extraction, the bone loss happen more in the back here. And we have a sinus, the maxillary sinus here and here can grow down, and you will not have bone in the back. So I can place comfortably 2 implants in the front, but in the back, in order to place the implants in the back, they will be in the sinus. So I cannot place 6 implants. So we used to do a sinus lift. If you'd heard the term sinus lift, simply it's a bone graft in the sinus. So we have to push the lining of the sinus up and place some bone, and just enough to place short implants in the back. So Paulo, he's a surgeon, and he said, if the sinus is here, so let's place the implant parallel to the wall of the sinus. And this implant will be long. And he take the concept of the bridges. If you look at any bridge, the posts of the bridges is not like straight. The posts of the bridges, they are angled to travel more. So if I have to build a bridge from side of the river to the other side, the post, if I put parallel posts, I will put hundreds of them. But if the posts are angled, this is a mechanical theory, that I can put it in a 45-degree, and I can travel more with less number of posts, so the construction will be less and even more rigid and strong. So he said we can place 2 implants in the front, and the back implants will be inclined backward. So, and I don't have to involve the sinus. So it starts from here to the end here. So I can travel more and it can reach up to the molar easily, engage more bone, so the implant will be even longer implants and more stronger foundation. And it end up by all-on-4 concept. So most of the patients that are missing the teeth, even after a couple of years, they will have a big sinus because sinus will pneumatize, they'll increase in size when you extract the teeth because there is no pressure. The sinus will grow in size. This patient will get the benefit of all-on-4 to have a more predictable restoration, easier restoration, and function. Another thing, simplicity. So it's easier to restore 4 implants than 6 implants than 8 implants, and less time. Um, like the time lapse between the finish to start to finish is less than if you have a 6 implant. You have to place bone graft because every time you place bone graft, the sinus lift, you're gonna wait for 2 months. And most of the time when we do sinus lift, we're gonna place the implants. So sinus lift for 2 months and then the implant for 2 months. You're gonna end up by waiting healing period for a long, long time. So nowadays we can place the all-on-4. We place the teeth in the same day. What? Yes, it's in the same day. With the help of the digital dentistry, we can scan the existing teeth if the patient has teeth, and we scan the bite, and we can design the temporary teeth digitally. And at the time of the surgery, we extract the teeth, place the implants all-on-4, and we place the restoration. The concept all-on-4, the every angle they have a counter angle. So if we angle the implant 45 degree, we put the counter abutments, the connector, to be parallel to each other. So the 2 implants in the front and the 2 implants in the back at the end, the conversion will make them parallel. So it's very easy to screw the restoration with the screw, that a special screw, immediately at the time of the surgery. What about the load? So the theory, the research said that micro movement, very simple micro movement, can help healing. So the patient will be in a soft diet for the time of healing with the temporary soft diet. Anything you can cut it with a plastic fork and a plastic knife. So it's not, doesn't have to be liquid diet. So soft diet means rice, pasta, cooked vegetables, very well cooked, chicken, no steaks, definitely no tough food, but anything you can cut it into small pieces with a plastic fork, plastic knife, that can be checked in. So after
For how
healing,
long?
so nowadays we used to wait for 6 months for healing. Now we can wait only for 2 months. After we can take the impression and move to the next step with the after 2 months. So in 2 months we'll see the patient for a check, take x-ray to check the healing, and then unscrew. It's like a Lego pieces. We're gonna unscrew the teeth in 2 minutes and tap everything, make sure that everything is healed, and we proceed for the next step, which will be the impression. Same visit, impression, and scan the teeth again, design the new teeth, and the following visit will be the final. So it needs only 5 visits to do that. First visit to meet with the patient and scan the teeth and do the smile design. Second visit is the surgery and placement of the temporary. The third visit would be just regular follow-up on the healing, be 10 days after surgery. The fourth visit would be the impression and scanning and taking the x-ray. And the 5th visit would be the final of the delivery of the final. So all-on-4 help. So what about all-on-6? So we can place, it's a minimum 4 implants if everything good at once. Can we place 5? Yes. If we have to, yes. When we have to is if when we place the implants, we find that the bone is soft. So we need extra implants. So we can place 5 or 6, whatever it takes to make the case predictable and the result will be predictable. But we always try to keep it simple to 4 and to be easier for restoration. Another question said, if one implant fails when you have 4, okay, so that's when we place 6 implants, it's better because 1 implant fails, still the restoration will stay. Yes, that's why if we are questioning the bone quality, we can place more implants. But even though, if one of the implant fail, so does it fail? Yes, very low percentage, like maybe 0.2% of the cases. If in a year we have like 3 or 4 cases, but if one implant fail, we still can unscrew, remove the implant, place another implant, and we screw back the restoration. Wait for another healing, but the patient will always have teeth in his mouth.
Have teeth, yeah.
Yeah, because we always do that. Even if 4 implants, never happened, but even if the 4 implants fail, we gotta remove them, place another implant for another location, position, and we place the restoration. So it's the same way. It's just postponing the healing, postponing the final, but at the end of the day, he will have something in his mouth. Okay. So for the all-on-4, I would say this is for many patients life-saving, because from the anatomy of the sinus, if we there's not we cannot do too much bone graft. We cannot do sinus lift too much. Some patients, they have polyps on the sinus already. The sinus is inflamed, so having surgery on the sinus is going to complicate the problem. So avoiding the complication of the sinus lift, avoiding complication and the time, expanding the time for all-on-4, it's a very, very, very good way to execute full mouth cases. We can do
And
upper and lower as well.
how is the maintenance for the all-on-4? Because
Right.
that's probably like a big part of the
Yeah.
success.
Like any dental restoration, we need maintenance. So thank God the implant, they don't decay and they don't have periodontitis. Can develop implantitis, yes. But we definitely, the patient has to go to follow up every 6 months, like routine 6 months implant maintenance. Do the cleaning. What we do, we see the patient, and every 6 months we see the patient, and one of the arch going to be taken out, unscrewed, cleaned, detailed, outside, cleaned. The other arch can be cleaned with a special tool, with a special rubber tips to clean the arch in the mouth. But the patient, from the day 10 days, from day 10, they will receive a water pick. Like we give the water pick from us to the patient. We teach him how to use the water pick. Who's the brushing?
Yeah.
Because it's easy to clean because there is no dental flossing. It's a one arch. Okay, there is no dental flossing.
So they do it from the outside and from the
Yeah.
inside too?
So the inside. Brushing usually it's
Yeah.
more helpful. And if there's something stuck with the water pick, can get it out. And imagine the soft tissue will be here and the leveled, and the denture will be, or the bridge will be on it, as contoured, as slim as we can. So it is not like a hard to clean. The only time that hard to clean in the beginning, when you have sutures, when you have stitches. After that, it will be very easy to clean. So in the beginning of the temporaries, whether it's upper or lower or double, because we do this in a single arch or full mouth, in the beginning, after 10 days after healing, the tissue gonna shrink because of the healing, gonna develop some spaces, okay,
The gap,
between
yeah.
the temporary, and the water pick now come to the very big help to clean in between and make sure that the area is clean. After we deliver the final restoration, all this gap will be, because we're gonna record it in the new impression,
Closed, yeah.
and new scan, it will be closed and contoured to the best of the patient hygiene. Yeah.
And the material of the crowns, do they look natural? Do they feel natural? Different materials are out there in the market?
Yes. So the material of whether it's the temporary or the final, it's 2 component or 2 colors. tooth color, and gum color, because we're not replacing only the teeth missing.
Yeah.
Patient gonna miss the bone and the gum around the bone. So part of it will be pink, part of it will be light, and the pink will be picked, the shade will be picked exactly like the patient mouth with the help of the camera, with the help of the computer and the software. So we give exact pink. So the patient smile with the pink and definitely with the white with the teeth. And the material, the will be printed material in the beginning, for the temporary, and the final will be zirconia. When zirconia, Radwa, the zirconia is the most like resembling material to the enamel, and
Mm-hmm.
looks exactly like the same color, the same shading, the same color tone, so we can predictably give the result. And remember, this is a full mouth case or full arch case. It's very easy to pick the shade. You don't have
Yeah.
to match
Yeah, to match.
these.
Yeah.
So you
Yeah.
pick the shade, and everything will be in harmony and are arranged together. So we look beautiful. Yeah. And actually, we change the patient life, not only the smile, because
Mm-hmm.
patients come for full mouth cases, they cannot communicate, they are shy, they don't look like they are really are. Okay, so I always tell the patient during the consultation, is, "Oh, you do this under sedation, okay, you will not feel anything, but when you wake up, you have the double T. So what is double
Yeah.
T? Tears in your eyes, okay, and teeth in your mouth. So patient really, when they see himself, they cannot
Yeah.
hold their tears, because it's just something that they always hear about it, and all of a sudden they are part of it. Uh,
Yeah.
so yeah, again, so that's the all in four. It's a term for the number of implants we used to restore a full arch or a full mouth case. Be all in four on top, all in four on the bottom, which is great help, especially for cases that they have big anatomical problem, which is sinus.
Mm-hmm.
Give more predictability, easy to clean. Imagine cleaning between 4 implants or 6 implants. You have more problems. The more engineering can cause more problems in many times. Okay,
And you said it takes only 5 appointments.
5 appointments in 3 months interval max. Yeah.
That's incredible. So you guys can, if you are missing teeth or you cannot chew because your gums are like bleeding, the teeth are not restorable, all on
or
four might be the
or
thing
having
for
or
you.
having dentures, yeah, and you want to upgrade from dentures to a fixed prosthesis,
Yeah.
nothing covering your palate. You don't have to take your teeth out at night. It's part
Yeah.
permanent, which definitely it's you enjoy your life more and more. Yeah.
Absolutely. So as a prosthodontist, what is the thing that you enjoy the most to do, like in dentistry?
I love, now in my role now, I enjoying every day after surgery, delivering the teeth. Patient coming after sedation is just see their tears, their happiness, hear words that I cannot explain it. It's just I can have just goosebumps everywhere when I hear that.
Yeah. Yeah.
We changing the patient, not only the smile, the life of the patient. That
Yeah.
most of them they can't wait. They are waiting all their life, just for this moment. And we
Yeah.
have different patients. We have young patients that they are, in part of their life they lost their teeth because of the maybe mistrack drugs or something like that. And I'm happy to be with them in this journey. Just I'm changing their life. I see the transformation of their lives, and to be a better person, better dad, better mom. So this is
It's very fulfilling. It's
yeah.
a very fulfilling feeling. Yeah. That was beautiful. And I really appreciate your time today and your explanation and your expertise. And if you guys have any questions, make sure you write your questions in the notes, in the comments below. I'm going to put Dr. Camel's information and contacts in the show notes. And make sure you check him out and check us out. And Don't forget to take care of your teeth so that they can take care of you, and keep smiling with Dr. Saad. Have a good one, everybody.